Well, today all of you are gathering to call attention to MRSA, one of the world's silent killers. And sadly, the MRSA epidemic is spreading worldwide and many are unaware. While it's hard to pin down exact numbers, in the US it's estimated that around 2 million people acquire hospital infections every year. And from my experience in the UK, it is shocking to think that about 1 in 300 patients die in hospital from something entirely different than what they actually were admitted for. If we had that kind of track record in the airline industry, we'd be grounded. If hospitals would implement a culture of safety, as is standard in many industrial settings, thousands of lives would be saved every year. The idea that you're going in for a relatively simple operation and are exposed to a potentially life-threatening infection seems completely wrong to me. More importantly, a good percentage of these would easily be avoided with straightforward hygiene, screening and control programs. The bugs do not discriminate. We are all at risk for infection. There's also unnecessary stigma tied to people that are infected, which is silly when you realize that 85% of infections are acquired in hospital. In fact, the bacteria are often found on otherwise healthy people. And with simple protocols and active detection, we can save lives in epidemic proportions and reduce healthcare costs resulting from extended stays and repeat illness. We should also learn from those that have made progressive and taken a proactive approach to controlling MRSA and hospital-based infections. It is possible to make a difference. With basic hygiene and screening protocols for healthcare workers and patients, countries like the Netherlands have been able to get infection rates to less than 1%. Western Australia and many Scandinavian countries have also shown great leadership on the issue. It's also important to recognize positive steps forward. The great state Illinois, where all of you are today, was the first in the US to put in place MRSA and infection reporting laws, with numerous other states following in their footsteps. Having access to good data and information is essential to managing and preventing the problem, and we certainly need better statistics globally. I know many of you have been affected personally by MRSA, and as we approach the 4th World MRS Day, I commend all of you for coming together and hope you can all become MRSA champions in your communities. Thank you for helping raise awareness of this important issue and for supporting the MRSA Survivors Network.